the latest coronavirus numbers in our state as Michigan's surge is beginning to show some small signs of improvement. There were 108 new deaths from the virus recorded yesterday. 75 of those were from a check of death certificates.
This comes as 4,800 more cases of the virus were confirmed, putting the total number of cases at more than 809,000. Yesterday, labs tested more than 58,000 samples for the virus, and just over 7,000 were positive, making for a rate of just over 12%.
More federal help is on the way. More than 200 federal personnel will be arriving this week to help with vaccinations at DeVos Place in Grand Rapids and at Ford Field and the TCF Center in Detroit. The workers are being deployed from the Department of Defense, the Coast Guard, and the U.S. Forest Service. As hospitals deal with a surge in patients, Mary Free Bed is reopening its COVID recovery unit. The physically isolated 11-bed unit is for patients who need intensive rehabilitation as they recover. This is the third time that doctors have opened the recovery unit since the start of the pandemic.
And nurses here in Michigan are reacting to the recent surge in cases. Today, members of the Michigan Nurses Association gave some recommendations about how to handle the surge to congressional representatives Rashida Tlaib and Debbie Dingell. Among those who spoke was Ascension Borgess hospital nurse Jamie Brown, who is also president of the association. She blamed hospitals not adhering to CDC guidelines for the deaths of more than 100 healthcare workers since the start of the pandemic.
And the answer is simple yet devastating. Our hospital employers and the state and federal governments simply don't want to know the numbers. If they truly wanted to control this pandemic and stop our hospitals from being disease vectors, they would have adhered to strict infection control protocols from the beginning.
The Nurses Association has been providing recommendations throughout the pandemic, including pushes for more PPE for frontline healthcare workers.